This is a healthcare crisis.
Abortion care is health care.
Abortion is healthcare, and we're proud to be a national leader.
In addition to the issue of a woman's choice, there are real medical indications at play here when you talk about the choice.
So, is abortion essential healthcare? To understand this, let's ask the question, what is healthcare? The main goal of medical and healthcare professionals would be to improve the condition of patients, restore them to good health, and avoid causing harm. Traditionally, the Hippocratic oath sworn by doctors played a major role in preserving human life at all stages. The original oath even states, "I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan. And similarly, I will not give a woman a pessary to cause an abortion." So, does this describe abortion? Merriam-Webster defines abortion as the termination of a pregnancy after, accompanied by, resulting in, or closely followed by the death of the embryo or fetus. When we refer to abortion, we mean the direct and intentional killing of a child in the womb. But aren't abortions sometimes necessary to preserve the mother's health? If a woman's life is in danger, would it then justify the killing of the unborn child? It is important to note that only 0.2% of abortions are done due to the risk to the woman's life. But even in such situations, would having an abortion automatically cure the woman? Let's consider a few cases. If a pregnant woman is diagnosed with cancer, the prescribed treatment is radiation or chemotherapy, not abortion. However, through the chemotherapy process, there is a high chance that the fetus would not survive. According to the principle of double effect, if doing something morally good has a morally bad side effect, it is ethically okay to do it provided that the bad side effect wasn't intended. This is true even if you foresaw that the bad effect could happen. So when a child dies in the womb as a result of cancer treatment, it would not be considered abortion. Abortion is sometimes also advocated for women experiencing high-risk pregnancy with complications like preeclampsia. Preeclampsia is a condition where the mother has high blood pressure and an increased amount of protein in her urine. If left untreated, this condition can cause damage to the kidneys and can even be fatal. In this case, it might be safer to deliver the premature child rather than abort a large fetus. In ectopic pregnancies, the fertilized egg usually attaches itself outside the uterus. The most common scenario, a tubal pregnancy, occurs when the fertilized egg grows inside the fallopian tube. In this case, there is a high chance that the child will not survive. Continuing with the pregnancy could cause the tube to rupture and could result in fatal blood loss to the mother. Thus, the morally acceptable treatment for an ectopic pregnancy is the removal of the section of the fallopian tube where the pregnancy is present, similar to how the removal of a cancer-infected uterus is acceptable. In some medical treatments, it is nearly impossible for the unborn child to survive. The difference here is that the intention of the procedure is to treat the illness or condition and not to kill the unborn child directly. Even in cases where the mother or child's health is a concern, the intention should be always to save both lives. The objective of healthcare is to treat an injury or illness, whereas an abortion is the intentional killing of an unborn child, and that is why abortions are never medically necessary. Hey guys, if you enjoyed this video, please do not forget to like, comment and subscribe. Also, if you have any question or just want to have a friendly conversation, feel free to DM us on Instagram. We'd love to hear your story. Until next time.